Namaskar. Good evening. Sri Rohit Kumar, CEO of Times Network, Dr. Dilip Bhanushali, National President IMA, Ms. Pooja Shetty, MD, Times Network, distinguished guests, award winners, ladies and gentlemen. I am delighted to stand before a distinguished constellation of healthcare visionaries, dedicated professionals, and trailblazing change makers, each of you scripting the future of India's wellness narrative with wisdom, courage, and innovation. My appreciation to the Times Network for conveying this timely summit. This is not merely a celebration of excellence. It is a clarion call to awaken thought, ignite innovation, and accelerate action in our health systems. This evening's theme, Future Care Innovation Driven to Healthcare Leap, echoes the pulse of a new Bharat. A Bharat where technology meets tradition, where data meets devotion, and where the sacred science of healing is reimagined for the times to come. Let us remember in the ancient words of India, Arogyam Paramam Bhagyam Swastham Sarvathas Adakam, which means health is the greatest fortune. It is the foundation of achieving all goals in life. Our Telangana state is charting a course of visionary governance in public health. Through supply of safe and potable water flows into every home, it strikes at the root of waterborne diseases. At the national level, India's commitment is equally resolute. Ayushman Bharat, the world's largest publicly funded health insurance scheme, has brought reassurance to over 50 crore citizens. The National Digital Health Mission is connecting our vast health landscape into a seamless, interlopable future. And through Ayushman Arogya Mandirs, preventive and promotive healthcare is reaching rural India, reviving our ancient ideal of community-based wellness. Prevention, not cure, must be our primary pursuit. This is the essence of our heritage, where the physician was revered not just for healing the sick, but for keeping the health in balance. Today, the stethoscope meets the silicon chip. From AI-powered diagnostics to robotic surgeries and smart wearables, innovation is the rhythm of modern care. Yet even in this era of silicon and code, let us remember the soul of healing. Compassion, dignity, and human connection must remain at the heart of healthcare. High-tech must always walk hand in hand with high-touch. This evening, we honor the doctors, researchers, hospitals, and institutions whose dedication breathes life into our nation's health journey. You are the custodians of health. You, the awardees of today, illuminate our path forward with your service, sacrifice, and innovation. May your example continue to inspire a generation of healers and dreamers. Let this summit not end in applause, but begin with action. Let us reaffirm our resolve to innovate with Shraddha, faith, to serve with Karuna, compassion, and to build a Bharat where health is not a privilege, but a promise fulfilled. I conclude with the eternal blessing from the Yajur Veda, Sarve Bhavantu Sukhina, Sarve Santu Niramha, Sarve Bhadrani Paschantu, Ma Kaschit Dukkha Bharabhavahet. May all remain well, may all be free from disease, may all minds be lifted, and may all remain happy forever. This is the most sacred mantra that our nation has given, or our civilization has given to the world. The inclusiveness. And I heard Dr. Dilip Bhanushali, the president of IMA, he has flagged many issues, and I'm sure if there are problems, there are also solutions. And I'm sure these will be resolved with due discussion, action, compassion, foresight, vision. These are things that are required for healthcare And I am happy to know that IMA is doing, Gaon Chalo, because I always believe and I strongly believe that healthcare must be delivered to the last mile. It is the last mile delivery that makes a difference. If we want a Viksit Bharat, we must deliver last mile. It has to go to the man standing at the end of the staircase. It must reach there. And that can only be done through vision, foresight, and our dedication. That is required. That is the most important thing. And I am very happy to be here in this beautiful celebration of healthcare. And I must congratulate all the awardees who are outstanding in their own fields of medicine. And I must thank Times Now Network for organizing such a lovely occasion or celebration in Hyderabad, a city of warmth, a city of many cultures that blend together to give you the essence of India and our Bharatiya culture. So I take your leave. Thank you so much. Jai Hind, Jai Bharat.
Thank you, sir, for delighting us with your words today. Ladies and gentlemen, before we proceed, I would like to take a moment to extend our deepest gratitude to the Honorable Governor of Telangana, Shri Jishnu Dev Verma ji, for gracing us with his esteemed presence today. So your words of encouragement and insights have added immense value to this event, and more importantly, your support towards healthcare initiatives and commitments to public well-being truly inspires us all. On behalf of the entire organizing team and everyone present here, we thank you from the bottom of our hearts for joining us today and lending your gracious presence to this important occasion. Ladies and gentlemen, can we please have a huge, resounding round of applause for our honorable chief guest for being here with us today. Before we proceed, sir, I request everyone to kindly rise for the national anthem once again. Thank you, everyone. Please remain seated. I request all our guests to kindly remain seated. In a few moments from now, we are about to begin a very interesting panel discussion. But before we go on to hear from our speakers who've taken out time to be here with us this evening to share their thoughts with us, to motivate us, inspire us, and enlighten us, I'm sure each and every one of you here this evening have a story to tell. So I'd love to invite one or two voices in the room today to share in about 60 seconds, one change that you believe will truly empower healthcare delivery in India. We will pass a mic around to you, but since we have so many of you, ladies and gentlemen, yes, we have a lady here raising her hand. Can we please quickly bring her a mic? Can we have a mic here, please? So, ma'am, I would love to hear your thoughts today on that one change that you believe that will truly empower healthcare delivery in India? I'm opening this question to all of you here today. We will begin with you, ma'am. Very quickly, can we please have a mic for her?
Start first aid as a subject in the high school curriculum. And for generations, we will save at least 6 people from dying out of 10. First aid in high school curriculum. CPR, first aid for choking, first aid for snake bite, first aid for fever, for diarrhea, everything.
That's an incredible suggestion that you've put forward. Ma'am, but we would love to know a little about you. Please give us your name, a little bit about what you do.
I'm Dr. Sivranjani Santosh.
Thank you, doctor.
I'm a pediatrician, a first aid trainer, and I'm trying to get ORS removed from high sugar drinks mislabeled as ORS.
Brilliant. Incredible, doctor. I think the suggestion that you've put forth will truly make a difference. I think it all begins with first aid being a part of the curriculum that every individual, every Indian should know. Right? Beautifully said, doctor. Do we have anybody else? Quickly, we'll take one more suggestion. Anybody else who would like to share your thoughts on one change that will truly empower healthcare in our country today? Anybody else who would like to share your thoughts? Okay, I have a lot more to interact with our audience today, this evening, but we will get back to that a little later because, ladies and gentlemen, as we move on, I would like to take this moment to give you a gist on what we have lined up for you next. From telemedicine to AI-driven diagnostics, Indian healthcare system today stands at the bank of a digital revolution. The India Health Summit 2025 today is set to witness the movers and shakers of Indian healthcare talk about revitalizing India's healthcare infrastructure, leveraging the digital power. Experts in the panel this evening will explore how technology can bridge gaps, boost accessibility, and build resilient health systems for the future. Please put your hands together in welcoming our honorable panelists on stage. Can we please have Dr. Guru N. Reddy, founder and chairman, Continental Hospitals. Dr. A.V. Guruva Reddy, managing director, Kim's Sunshine Hospitals. Dr. Yedavalli Subramaniam, CEO, Apollo Hospitals International and Andhra Pradesh. Mr. P. Hari Krishna, Executive Director, Medicover Hospitals. And may I please invite the moderator of this session, Kalpana Sharma, Editor, Health, Times Network, to please make her way onto the stage. Over to you, Kalpana. The stage is yours.
Thank you so much. Am I audible? Okay. So we are here and we have a very, very exciting panel today. Healthcare, as we all know, is standing at a very interesting juncture in terms of innovation, collaboration, and growth. And who better than the esteemed panelists here to talk about it? So let's straight on dive in to this discussion. Dr. Guru Reddy, my first question would be for you. You've built Continental Hospitals with a strong focus on quality. And, in your experience, how can we really leverage that kind of infrastructure at a low cost?
That's a wonderful question for the audience. I think the very premise of my transition from America was to focus on healthcare infrastructure, which was the biggest need for this country. My traveling across the country from 2007 to 9, before I embarked upon this mission, was primarily to understand what is required, what is ailing of healthcare delivery in our country. So given that prerogative, I ventured upon to build, one of the best infrastructure-oriented, facility. Now, your question is that when infrastructure costs so much, how can you really, maintain or control the costs in terms of care of the patient? Good. It is doable. It is very doable. And I'm going to just expound on that if you give me about 60 seconds or a minute or two.
Please take your time.
Yes. So from the get-go, when you design an infrastructure, then you need to have a clear vision and a mission. So my vision and a mission is and was, at the end of the day, can I really focus on the human resource that we can train in terms of what constitutes a quality delivery of healthcare? Okay. Number two, can I really have a group of doctors or the entire faculty who can marry that vision and mission, who essentially envisage that quality delivery at the end of the day is not only something that is required, but what it means to the patient in terms of, their progress and recovery. And last but not the least, in any venture in healthcare, quality assurance has to marry with quality delivery. These are two very important terms. By quality assurance, we talk about infrastructure, we talk about human resources, we talk about technology. By quality delivery, we are talking about that human resource that you employ, where they are continuously trained to bring them up to focus on, what constitutes quality in terms of its delivery. If you can control these things, I have come to a conclusion at that point in time. Let me experiment in India that in spite of having advanced technologies and a great infrastructure, can we control the costs? And we have exactly proven that. One of the greatest examples is we were labeled as 7-star hospitals, 5-star hospital, and a lot was discussed in the press. But I was the only one in the Twin States for an ultra-modern infrastructure where we have accepted to take the Arogyashri of the Telangana government from the very first day and the get-go. Because I had the significant experience in America how to manage capitated contracts. Given that experience, I've instilled that, the process amongst the entire fraternity, not only the doctors and the nurses. When a patient comes to the hospital, be quick in your diagnosis. If the government has to give an approval, present to the government all the appropriate, indications that the government is demanding. Don't confuse them. Number 3, I appeal to the governmental person or bureaucrat who is responsible for Arogyashri. Can you please help us to sanction this at a very fast pace so that we are not wasting unnecessary days in the hospital? So a combination of all of these things, and then we had electronic medical records from day one. So there was no confusion. They had no difficulty in interpretation of writings. It was crystal clear. There was no changing of your diagnosis. So all of these things we have proven in my venture in 2013 and 14 that it is possible. If we can take what the government was offering and make it successful at the end of the day, then that was my biggest confidence that we can control costs and still make it effective.
Thank you. That's a very, very inspiring note. And I will, with the same thought, I'll move on to Dr. A.V. Gorva Reddy. And so you've often spoken about, delivering world-class care at Indian prices. So what operational efficiencies or models do you think can be adapted to really make that true?
Unable to hear you properly. The speakers are that side.
Okay, I'm saying that I'm extending that question to you as well. You've often spoken about, providing world-class healthcare at affordable Indian prices.
Yeah.
So how do you think is that scalable, and what model can really work for us?
Yeah, as my colleague and dear friend told that, I would always believe that there is one adage I always love to recapitulate. Any healthcare industry or a healthcare facility should be big enough to serve and small enough to listen. That is always my thought process. So the affordability comes from the concept. Because the MR scan costs 10 crores, you don't need to charge 10,000 rupees to the patient. And again, the second is, it is in the numbers. And third point is, healthcare delivery cannot be seen return on investment. There is a fundamental problem with some of the entrepreneurs or the people who put money in the healthcare, the ROI. That is a very wrong concept. The return of investment is not there. The services are entirely different. The experience is entirely different in the healthcare. And affordability comes from the concept, number one. And number two, optimizing the compromise. That is another buzzword for me. When I came back from England, a lot of people said, you can't practice in India without cutting the corners. I said, cutting the corners is different. Optimizing the compromise is different. So if you go to Western countries, humongous money, I'm sure Guru will agree, is wasted in the theaters, in the OPDs. Here you can optimize that. And here our efficiency in running the operating theaters, in optimizing the infrastructure or optimizing the consumables is 100 times better. That's why the value for money is much more here. And that is the key word to make it affordable. But first of all, you should have in your heart, not in the brain, that it should be affordable. All the things can be afforded to them.
That's very interesting to hear, and especially because you both have been on both sides. You are doctors as well as managing hospitals. So that's very inspiring to hear. I move on to Mr. P. Hari Krishna. And so given Medicover's, European background and India expansion, what are the, designs and planning that you are getting into to really make it an India model?
So before I answer this question, I would like to thank the Times Group and also tell you I'm honored to share the dais with Dr. Guru Reddy and Mr. Subramaniam, also along with my mentor, Dr. Guru Reddy. I never thought I will share a stage with him here. Thank you for making me part of this. So Medicover is a European healthcare chain having presence in over 14 countries along with India. Where we have 6,000 beds spread over 4 states. So the investment, as Dr. Guru Reddy sir was telling about, return on investments, you should not look at it. You should look at more from the passion point of view. That's where when we had a choice of raising money from a private equity versus a strategic investor, we went with a strategic investor because private equity most of the times come with the return on investment and the time horizon where they have to exit. So when we chose Medicover partnership and aligned with Medicover in 2017, from there it really helped us because we from India bring on the table the best doctors. Nobody can match the expertise of doctors like Dr. Guru Reddy with the kind of volumes he managed, with the kind of skill he brings in. But, the European chain will definitely help us in lots and lots of other things like detailing, audit process, construction quality, or be it efficiency in air conditioning system or many other activities which Europeans have pioneered, and when they couple with Indian skills and Indian way of working or bringing in the cost efficiency, that is proving us and that is helping us to establish better and grow faster.
Thank you. I move on to Mr. Subramaniam. And we all know that, Apollo in some way has led the digital transformation in healthcare. So how do you see that infrastructure complementing physical infrastructure?
Thank you so much. First, let me thank Times Network for inviting us, and also I thank my co-panelists. In fact, I worked with Dr. Guruvareddy, I worked with most of the people here. I also thank the audience to willing to listen to us actually. So, digital transformation, it is something which India requires at this point of time, world requires at this point of time, because the accessibility and equitability medicine comes only through digital at this point of time. Because India is a very, very vast country. We can't expect at every nook and corner there is a specialist available and doing it. So digital infrastructure, by developing the example like telemedicine, tele-ICUs, EICUs, these things would complement the physical infrastructures which are available largely in the cities. Say for example, we run a lot of telemedicine centers in Himachal Pradesh where, it's very difficult to even travel. But, we could able to do lot of tele-emergency cases there, tele-ICU cases through this particular thing. So there is an infrastructure, the hub available here physically, but at a telemedicine, at a telemetry level, we will be able to do this particular thing. So the equitability and accessibility can come only this. But I always tell, it cannot replace a doctor. Nothing, no technology in this world can replace a doctor and a nurse. This can only complement them. So if anybody thinks that, one day, will only the technology will treat the patient, it doesn't happen. It happens only there. It's always Vaidyo Narayano Hari, God. Doctor is always a God. So we always respect that. And, this particular technology should enable and give that access to the doctor to treat more. That accessibility can come. So this physical infrastructure and the technology married together would be able to, we will be able to treat more patients with more technology innovations. This is the future.
Rightly said, we cannot ignore digital and definitely not do without doctors.
Yeah.
So, Dr. Reddy, my next question would be to you. I mean, you are in a panel and how can we not talk about gastroenterology? So, I would like to ask you that, we've seen rapid advancements in terms of minimally invasive procedures, AI-assisted surgeries, diagnostics. So what do you think India needs to do to really become a global hub in terms of, for high-end gastro care?
India is already very well recognized for its physician fraternity. There was a recent, I think 2024, assessment of the physicians of which countries of the world are at the top, second, third, fourth, and fifth. I'm sure the audience are aware. If not, they'll be surprised. After the United States of America, Indian physicians have been voted number 2 in the world. And after the number 2, Germany, UK, rest of the European countries fell in place. While we enjoy this great reputation, unfortunately, we are challenged with a very chaotic healthcare system, where we are ranked in the Global Health Security Index 66, where we are ranked in terms of accessibility and quality of healthcare 165 amongst 195 countries. So while we face this battle in terms of our recognition globally, while we have an extraordinary physician pool, not only the physicians in this country, but our doctors, made India shine wherever they have been across the globe. To answer your question, we have never been shy in embracing and adopting technology, particularly the last decade. Today in India, after spending 4 decades in America, where I still travel every 2 months, I have been a leader in many societies and organizations there, I could see the difference between the two countries in terms of how India played the catch-up game. There is no metropolitan city of this country or any urban healthcare center where a hospital is not equipped with almost all of the technologies that a US hospital has, if not more. So we are talking about surgical instrumentation, imaging instrumentation, the onset of robotic revolution that is happening. So we are there. This will be our century. We are catching up at a rapid rate, and there is no dearth for investment in terms of these technologies. But the unfortunate and the sad story is that only 26% of the rural India is equipped or have some sort of basic technologies. So we cannot live behind 600 to 700 million people while we enthrall on these bigger hospitals, urban technologies, and accessibility to a fraction of the population. So somewhere or the other, if this divide can be bridged, we can be the greatest nation in this world. So I think technology is important, but use of technology is also important. I think if you focus on technology as a rate of investment at the end of the day, and just getting something to do something to make money, I have completely detested all my career from west to the east. So we have to be careful when we are really adopting a technology of how well it will serve a patient. One last example to give. For the last 20 or 30 years, we have witnessed a dramatic transition in the surgical approaches to human disease. From open surgery to laparoscopic surgery, in today's world, minimally invasive surgery to robotic surgery. The question we ask is, does every patient who walks into your clinic or hospital, does he require or deserve a robotic surgery? Does everybody require a minimally invasive surgery or a laparoscopic surgery? These are the questions ethically one need to address. There is no point in putting a patient into unnecessary, dire stress by offering him something which is not required, which is still relatively emerging, where we are still going through a process as to which is the best tool. So one has to be cognizant in deployment of these technologies to the point of realization that in India, affordability, accessibility is still a great challenge. And if you're mindful of that, I think we can use the technologies properly.
Thank you. And again, related to affordability, my next question would be, India performs a growing number of joint replacement surgeries, and yet access remains limited outside of urban hubs, as we know. What do you think can be done in this space to really make that accessible for more people?
Joint replacements?
Joint replacements.
Yeah, my forte.
Yes.
Okay, yeah. When I came to India from England 25 years back, my first job was in Apollo, when Subbu was a young marketing man. And we have traveled a long way. The first year, I think there was around 100 joints done in Hyderabad. Now I myself do 4,000 joints per year. One of the largest numbers in joint replacements is India after America. We are the leaders there. But unfortunately, as I say, for every one joint I do, there are 10 people who can't afford a joint replacement. And joint replacement is one of the few branches where the success rate is very high, but the consumable cost is very high. Because the implant costs half of the price. But thanks to Prime Minister, the prices are cut, and now it is almost 30% cheaper than before. But having said that, still there are millions of people who can't afford that. But again, thanks to the government schemes, there are with the Prime Minister scheme and all that, joint replacements also done in that gamut. And Now, from my point of view, I said every surgeon's life is in 4 decades. First decade is learning, second decade is earning, third decade is teaching, fourth decade is giving. I am in the 4th decade. So we have started a Sarvejana foundation in which we got a scheme where we put the knee joints to the poor mothers. So the slogan is one for mother, one for other. So you give one joint to your mother and donate one joint to other. So we have done already around 200 joint replacements, but it's a small drop. Many more people to be coming on board. But I am sure with the insurance schemes, with the government initiatives, with the awareness is caught up tremendously well. So we have gone forward. And again, as the Guru was saying, the robotic joint replacements, we are the leaders. But it doesn't mean that robotics is the God's gift to the joint replacement. No, a manual joint replacement is as good as a robotic joint replacement. But robotics has got some marginal advantages, and that's it. So, but your question is very appropriate. The joint replacement is a lifestyle changer. It is not perceived as a lifesaver, but is a lifestyle changer. But I have seen many women in our institute. We have seen one tailor woman. In COVID, she lost her husband. She could not do the tailoring because of the arthritis. We gave her new joints. Now she is able to earn her bread. So like that, so many stories where the inability to walk to the toilet is humanly so degrading, and that you should really address. And joint replacement has to be a part of regular health care.
Thank you so much. Mr. Subramaniam, my next question would be to you. Since we are talking about, affordability and as well as ethics, like both the doctors pointed out, with Apollo's pan-India footprint, what are the biggest roadblocks that you see that, that makes this healthcare and this reach a little difficult in the smaller cities?
Can you just repeat? I'm not able
Yeah, I'm saying that.
Can you turn one of the speakers this side? Because it's absolutely incomprehensible.
Yeah, not very difficult.
Okay, I'll repeat that with Apollo's pan-India footprint, what are the biggest roadblocks that you see in terms of infrastructure development in smaller cities, in tier 2, tier 3 cities?
Okay. Actually, it's a really beautiful question, because as you very rightly said, we are pan-India. We have across entire India and almost about 80 hospitals now, bigger hospitals. We also realized that tier 2 and tier 3 cities, when we wanted to do something like what we are doing in Hyderabad, it is not possible, tier 1 cities. So we have come up with a model called REACH, Apollo REACH Hospitals. It is a model where it is fit into the infrastructure wise, the budgets wise, the way we operate. It's an operational efficiency fundamentally. These things are slightly modified and understood, innovated fundamentally to suit the tier 2 and tier 3 cities, where we will be able to offer the same quality of medicine, but in a different way of doing operational way of producing these results. The results are absolutely same, the outcomes are same, but it's a basic innovation. We operate in a smaller environments there. We use lot of tele-technologies there. If we really look at the very remotest villages, we should be able to serve, as Dr. Guru Reddy said. It's important that we cannot say that that population we will not. So we have to innovate these products. We have to innovate the technology in such a way. We have to innovate the entire infrastructure in such a way. We have to train our people, personnel, to deliver such deliverables in those environments. It's a great study. I can talk days together on this subject because I was involved in creating these models
Yes, I
from
do
the
know that.
beginning, you know, in various rural population, whether it is telemedicine, whether it is, you know, the rural clinics where we operate in AP and all. It's a beautiful subject. We need to have that vision that yes, we should treat these things, and we create infrastructure accordingly. We create entire delivery system accordingly. So challenges are there, but they're not impossible. We have seen this happening. I think, sir, you want
Dr.
to
Reddy wanted to add something.
The biggest roadblock of developing the healthcare in Tier 2 and Tier 3 metros is the wife.
Please elaborate.
Because you see, the children need a good education. Let us say, example, you take a gastroenterologist or a cardiologist or an orthopedic surgeon, we will ask them, boss, you go to the Tier 2. The next day he will come and say, I won't go. Because his wife says, what about children? What about children's education? Because that's important, isn't it? So that is the main crux. Because the Tier 2, Tier 3 do not have a proper educational institutes matching this one. So that is the aspiration number one.
Yeah, I think this is the first.
Yeah.
We have never heard
That
this
is a
issue
practical
before.
reality which we see, isn't it, Guru? Yeah, very, very relevant point. And so the wife and children decide whether this doctor will go there or not. That is the biggest stumbling block. How to solve that, I don't know.
So it must be your last question to me. I just want to congratulate every doctor here for and every healthcare professional for getting these awards. Thank you so much. Very honored to be a part of this group.
So before we end this panel, I would like to throw a question across to all four of you, and maybe you can start with it. That, you know, how do you see the overall healthcare system in India evolving in the next 5 to 10 years?
If you see healthcare over last 1 decade, or if you see the kind of listings which are happening pre-COVID and post-COVID. Pre-COVID, there was only one Apollo hospital or one or two others which were listed. Now you see the maximum DRHPs which are getting filed with SEBI are healthcare. So this is one such indicator that healthcare has a growing interest. Healthcare, there is a growing need, and healthcare is going to be the future of such a large country like India, where you have 1.4 billion population, which needs a proper healthcare, which needs a quality healthcare, and which also needs a affordable healthcare. So over last 5 years, if you see the number of hospitals which are expanding, the number of beds which are coming, which will clearly indicate that this sector will definitely grow leaps and bounds. But there is a scarcity in getting, the doctors. It's not just wife, it is also mother-in-law, father-in-law, father, mother, all plays the role of starting a hospital in rural. Because we run hospitals right from Srikakulam, which is a remotest place of Andhra, here, Nizamabad to Varangal. Varangal, we are the only corporate chain which have entered. So we encounter this problem every day. So this is a genuine issue. But the whole family also plays a role, and also the infrastructure. There are no hotels, there are no pubs, there are no other place, or not just schools, because everyone wants their social life need to grow. So the healthcare has to literally reach to the rural. Because if you see Hyderabad, the place where you are sitting, if you draw a 10-kilometer radius or even 5-kilometer radius, there are 6,000 beds which are operating. Nowhere in India we have so many hospitals. But if you see the rural market, many cities, none of the chains have entered or even thinking of entering. So healthcare needs to move towards the direction of going to tier 2, tier 3 towns. Then the load on the cities also will get reduced.
Thank you, and I know the time's up, but I would like to hear your thoughts as well.
Good. Thank you, Hari. I think you're very well illustrated. On an optimistic note, we have a fantastic future. The fantastic future lies in the fact that we see new hospitals being announced, new medical colleges being announced, and our distinguished IMA president earlier today in his keynote address did mention the goal and ambition is having, one hospital per each district, so one medical college per every district and all of those things. Okay. Prime Minister Modi, I think in his very first term, has doubled the undergraduate medical education in this country from 55,000 to more than 1 lakh, or today it's about 1,20,000 MBBS graduates. He has also doubled our postgraduate education. We are basically today about 60,000 from 35,000 people. So the crunch of human resource in terms of the physicians over a period of time, probably in a generation, I think we're going to overcome that. Probably the world will be quoting about India's physician-patient ratio rather than quoting the World Health Organization. I'm extraordinarily confident, as the Prime Minister has echoed a few years ago, he wants to see Indians in all the 195 countries of this world to be practicing and controlling the healthcare. And with this kind of production, I'm extraordinarily, optimistic. But let me just reflect on the realities. Is that simply production of the doctors is going to address this issue of competent healthcare in our country? The answer is no. We have to focus on the healthcare spending and healthcare budget. As our IMA president has mentioned, with 1.8% of the entire GDP being spent in healthcare is extraordinary paltry. Today, when we compare to our neighboring nations, in terms of quality and accessibility, India ranks lower than Bangladesh, than Bhutan, than Sri Lanka, and China. It's very shameful. It's absolutely shameful. So we are focusing on entrepreneurialism at the end of the day, major metropolitan cities, private equity investors, and changing hands and listing of IPOs and robotic technologies at the point when we are really kind of missing, the larger segment of a population. So increasing the spend of the government is absolutely a crucial need for our country. We are the lowest. If India wants to leapfrog, as the Prime Minister says, to become the developed nation by 2045, we cannot be doing with 1.8%. All the developed nations of the world, they are spending more than 10% of their GDP today. Yes, they may not be the best. You can say that America, with $4.5 trillion, still ranks, as 34th in the world, but nevertheless, they're taking care of the people. Do you know what is the healthcare total expenditure of India? It's 3.6% of the GDP. So here is 1.8% the government is spending, but the actual expenditure is 3.6%. So where is this coming from? Who is bridging this gap? Unfortunately, the out-of-pocket expenses, where people are going through catastrophic, spending and liquidating, and so many things are happening. The other last thing I want to reflect on, many times we think that hospitals are gouging, they have to spend so much, doctors are charging, the salaries are very high. Many of these things might be true. But end of the day, if you look at what an average Indian family spends on education, an average Indian family spends on leisure and vacation, and an average Indian family spends on healthcare, you'll be surprised to see this, you're surprised to know the statistics. We spend less on healthcare, an average family, than their education, than their leisure and vacation. You'll all be surprised to know that. So our per capita expense, which means to say that individuals and families have to give more attention to their healthcare. And how can they do that? Focusing on prevention, following the doctor's advice, taking the medications right, and do not wait till the end stage of the disease and when they are basically transitioning to a catastrophic stage and burning lakhs and lakhs of rupees and becoming a burden. So individual responsibility is extraordinarily important in this whole journey for our country to emerge, to one of the great healthcare destinations. Thank you.
Very important point.
Yeah, I am excited. India is going to be good in the next decade for 1, 2, 3 reasons. Infrastructure is getting better. The awareness of the people demanding for a good health is getting better. Government is doing definitely proactive. As Guru said, the GDP has to be spent more, but the days will come, definitely. And accessibility is getting better. telehealth is getting better. So I see all the positive things. Next decade, 20 years, we will be definitely able to cater to all the 140 billion people with a good outcomes.
I have only 4 words. One is, future is it's going to be predictive. It will be more predictive. It will be more innovative. It will be more accessible. And it is more inclusive. I think these are the 4 things which we can predict.
Thank you so much. Here's to good health, and thank you, panelists. It was a lovely discussion today. Thank you so much.
May I please request our panelists to please stay back on stage. I request our speakers to please remain on stage just a little longer. I request all our speakers to please remain on stage. Exhilarating and enlightening indeed. What a power-packed discussion that was. Now may I please welcome on stage Ms. Pooja Sethi, Managing Editor, Digital Times Network. I request our speakers to please come back on stage. Our speakers to please come back on stage. Yes, I invite Ms. Pooja Sethi, Managing Editor, Digital Times Network, to take this moment to present a token of our appreciation to our esteemed panelists for taking out time from their busy schedules, being here with us today and sharing their thoughts with us on this wonderful platform. Can we please give them a huge round of applause? I request our dignitaries on the dais to please come together, our panelists and Ms. Sethi to please come together for a group photo opportunity. Once again, let's have a huge round of applause for them, please, ladies and gentlemen. Thank you, ladies and gentlemen. The next session this evening is a special one, or rather a sensitive one. We are set to talk about reshaping women and childcare in India, innovation gaps and the way forward. India stands at a crucial crossroad in its journey towards inclusive and equitable development. While significant strides have been made in improving women's health, Ranjini Santosh, pediatrician, Magna Centers. Dr. Jamuna Devi, Gudi Divoni, gynecologist, Yashoda Hospitals. Dr. Satish Ghanta, neonatologist and pediatric intensivist, founder Little Stars and She Women and Children's Hospital and Choice Foundation. Dr. Ruma Sinha, gynecologist, laparoscopic and robotic surgeon, Apollo Hospitals. This session will be moderated by our very own talented Miss Pooja Sethi, Managing Editor, Digital Times Network. Now, before they begin, can we please have a huge round of applause for our eminent panelists? Ladies and gentlemen, I don't hear you. A huge round of applause, please. Over to you, Miss Sethi.
Thank you. India's future rests on the well-being of its women and children. With this very interesting panel of leading doctors and gynecologists, let's discuss how we can how we can reshape women and child health care through policy shifts, innovations, and a more holistic approach. Dr. Pranati Reddy, I would like to start with you. In your experience, how can we better integrate preventive care like early screenings with regular checkups into mainstream health care to ensure women across India have access to lifelong wellness?
So, I think the most important thing that we could focus on, because I think that's really an indicator of the kind of quality of healthcare that a nation can provide, is maternal health, in terms of pregnancy and delivery. And if you look at things like early screening, I guess it will be important for us to start at a point which can be the very worst outcome for a woman who's pregnant. A woman who's pregnant, who's trying to bring new life into this world, if she dies, and that's maternal mortality. And while we've been good, a woman dying while giving birth is a very unacceptable outcome. If you look at that from our own country's point of view, we've been good about it, I think. I think we've brought it down significantly, but at 97 per 100,000 births, which means, around 35,000 women are actually dying giving birth. It's something that we need to look at very closely. And prevention, like Dr. Bhanushali was mentioning, is better than cure. And if you look at this landscape of maternal mortality, it teaches us a lot of lessons. You find that the lowest rates of maternal mortality are in the southern states. Kerala is at 19, Telangana and Andhra are at 40s. Karnataka is at 57. So if somebody is at 19, 57 and 40 with an overall maternal mortality of 97, there should be somebody at 200, 170. And who are those at 200, 170, 180? Assam, Rajasthan. And the common theme here is, poverty, remoteness of areas, lack of education, and these are contributing most to maternal health. And this is a challenge that we face. And I think there are a lot of things that can be introduced to prevent this from happening. And I think a lot of things have been done. The government has been really proactive to have brought down that maternal mortality rate. But definitely, 35,000 women dying is not acceptable. And I think it should start right from the point of the antenatal journey. The way we view pregnancy itself is not holistic. We look at the end point of a pregnancy, which is delivery, which is actually a very small step in this long journey that a woman goes through to deliver. And while our focus remains on that, and we try to prevent or we try to optimize outcomes at the end of a journey, where we should be beginning in the beginning of the journey, like you're saying, the preventive measures. So I think it's very, very important to focus on antenatal care. I mean, when a woman becomes pregnant, and far before that. If you look at how we treat our education system, or how we talk about success and how we train our children, we send them to coaching schools for acing IIT. It's so important to teach our girls what it is to become a mother, So motherhood sometimes is an over-glorified thing. I think it's important that they go through knowledge should be the basis of making a choice about getting pregnant. And pregnancy eventually has to be a choice and not an expectation in a fully informed individual. So I think improving education and obviously, fighting poverty levels, giving more agency to women and focusing much, much before a woman gets pregnant and not just, when she's about to deliver, when really you may set them up for failure. So, Muhammad Fatahullah, one of the leaders in maternal health, once said that women are not dying because we can't prevent the diseases that they're dying from, especially not that we can't prevent what's going wrong in pregnancy. They're dying because societies and nations don't think it's worth saving their lives. And I think that's where the transformation can start.
Such a sad thing too, if the society thinks
it is
like that.
true also, isn't it?
Yeah,
so I think anything that goes in the way, and financial incentivization may not be the answer. I'll take whatever they give, doing the Janani Suraksha Yojana and the Pradhan Mantri Yojana. They're all good. I'll take whatever they can give because, if a nation is investing in improving maternal outcomes, I'm grateful. But I think it has to be a revolution which starts at a much basic level, and that can only come through education. And I think going forward, the only equalizer in maternal health care is going to be technology.
Thank you, and I think you're doing incredible work in spreading this awareness. I'll now move on to Dr. Sivranjani. I've been chatting with her the entire evening, and I think she's a crusader in so many ways. So, Dr. Sivranjani, you've done considerable work in child health. And what do you think now is the hidden danger with adding energy mixes in children's drinks, which is very prevalently happening across the country?
We all know, everybody sitting here knows that adding milk mixes, first thing, dental caries. Second thing, the child is going to develop a craving for sweet taste. And this is the beginning of obesity. Now it's a pandemic now. Epidemic, pandemic, whatever you want to say, obesity is there, and this is the beginning. This is the beginning, and whether it's sugar or jaggery, all the milk mixes are loaded with either of them. Bonvita or Boost or Little Joyce or Grizzo. All of these are loaded with either jaggery or sugar, and we have to stop this. We have to stop this and obesity. Huh?
And how do we do that?
We have to raise awareness. We have to tell the mothers. Mothers are very vulnerable. It's very easy for them to believe that they should take the shortcut to give, nourish their child. Okay, they'll have some 101 millets in them, they'll have sugar, jaggery, and they say that they have double the amount of protein. What do they mean by double the amount of protein? If I give one egg and some tumbler of milk, my child's protein is done, and then again he's eating dal and rice. Why do I need extra protein? So, raising awareness, and government has to bring strict regulation. Like some countries have this red dot on foods containing excess sugar. So government has to do something like that, in the labeling. Okay, like how for organic food we have a green dot. Something like that, so that the parent knows, okay, if I'm buying this, I'm giving loads of sugar and jaggery to my child. And no shortcuts. Let children enjoy real food without watching TV, without watching cell phone. Eat the food and enjoy the food. This is the culture we have to create.
We have to imbibe that and create more awareness about this. Yes.
Adults also have to do that. We have to set an example first.
Yeah. Well said. I'll move on to Dr. Jamuna. Dr. Jamuna, you've been a pioneer in women's health again, and you've been a gynecologist for so many decades. So in your practice, what do you find are the most significant barriers to women accessing timely and high quality gynecological care, especially in rural India?
Thank you so much. Actually, I should thank the Times team for inviting me, and my good friend Dr. Aarti, who has connected me to this group, and the listeners, of course. The basic barrier is facility level barriers. Though we have facilities in districts or primary health centers, still they are not updated. Still they have lack of human resource, nurses, doctors, and infrastructure also. And at the same time, the distance for the women to travel, especially from the remote areas, to come to the facility is so difficult. As today somebody said that in hilly areas, we have seen that there are no track or no road. They have to come either carried or, so such is the difficulty. And there is a lack of awareness among women that the facilities are equipped with so many projects and all those things, and they are never aware of these projects. And other thing is, still the societal stigma is there. The women doesn't talk about her reproductive issues. And these things, I think, give a setback for her to come forward for her issues. And at the same time, I think we need to see that prospective numbers which we have achieved, though we have so many gaps, that institutional deliveries have been increased by 88% from 39% because of this Janani Surakshit Yojana, where they have given the cash, conditional cash transfer. And because of that, I think to some extent, the institutional deliveries have happened. And that is a, plus point, and it is a prospective point. I think
that's very, very important. Yes. Thank you. Dr. Satish, I'll come to you now. You, with your integration of AI, are doing amazing work in, preventing diseases in children. So neonatal and pediatric intensive care in India is still underdeveloped, especially in smaller cities. So what are the key infrastructure training gaps that need to be addressed? And with the rise in premature births and critical care needs for newborns, what advancements in technology and treatment do you think can bring about that change?
Yeah, it's a very, very important question, and very, very well thought about question as well. But the most important thing here is, yes, if you see across the country, newborn intensive care as well as pediatric intensive care, you have the best hospitals with the best equipment, with the best infrastructure, and the best people to man them. It's not just the equipment and the infrastructure. You need to have good people. It's not the machine alone. It's the men or the women behind the machine. But the problem is, just like how you have the best, you have the most, the pathetic kind of scene, when you go into the rural areas. So there's a huge divide between the haves and the have-nots, and the urban areas, the level 3 or level 4 centers in the cities, and the rural areas. So I wouldn't say there's no infrastructure or there's no equipment or there's no this thing. There is a lot. But the big question is, how do we bridge the gap?
Yes, that's important.
So that's the big question. We all are aware, and there's no easy solution to this. 2 cents worth of a solution would be, what we are doing at a smaller level is telemedicine. We have something like a cloud ICU, where in the intensive care in Hyderabad, because we have the whole expertise of the newborn intensive care specialists, the pediatric intensivists, you have the subspecialties, the nephrologist, the gastroenterologist, and the hemato-oncologist. The best way is if you could have a group or a network of hospitals connected with telemedicine, where the Supreme Court has come up with fantastic guidelines as to how it's got to be done. You can't prescribe medicines on the phone, but telemedicine is there. During COVID,
it's gaining
beautiful,
popularity
yeah.
recently. Yes.
So if you could use that technology, we have IoT. Your monitors, I can see the monitor real time, not just a video of the monitor. It's connected through IoT. I can see the a child, I can talk to the doctor, I can even, even the lab investigations are integrated. So my intensivist sitting here can cater to the intensive care needs of, even the rural areas. And that is one way. Guruvareddy sir has mentioned one problem. He said the wife, I think, sir, this is one way you can sort it out, where you can have the specialist sitting in Hyderabad and, you could sort it out. So that is one thing, infrastructure. The second thing is we have we need fantastic nurses, the kind of quality care that we do, but there's a very high level of attrition. You train them, we have fantastic training modules, both in newborn and pediatric intensive care, but there's a huge attrition. And then obviously that's a learning process and you need to go on and on.
That's attrition is in all fields, not just nurses in medicine, which is a reality we all deal with every day. Dr. Ruma Sinha, you've been a pioneer in laparoscopic and robotic surgeries. So minimally invasive surgery has revolutionized gynecological care. How do you see the adoption of robotic surgery affecting access to high quality care?
Thanks, Pooja. And thank you, Times Healthcare, for giving me this opportunity to actually put some of my thoughts across to everybody. I heard Pranati with a lot of interest, and actually Jamuna and everybody else here. When we talk about women and health, as a policy maker, government, as society, or even family members, the maximum attention the woman gets is when she's pregnant. Everybody will go to the best care that they need. Or at the end of the life, somebody diagnoses that she has a cancer. What happens to that woman when she has menarche at 10 years old, lives up to 80 years old? Who's looking after her gynecological and reproductive health in all those years? And that's something which we need to think about. Women may have simple pelvic pain secondary to simple things like fibroid or maybe suffering from endometriosis. It just gets to the backside and nobody actually brings that to the forward. That is where the minimal access surgery and now the advent of robotics can help these women gain and improve their quality of life. So I'm just talking about simple things like quality of life for women. If you look around in your home or yourself sometimes, you'll feel those are those few years where you actually did not bother. We went on with, even supposing you have simple period pain, you went on because somebody else needed the attention at that point of time. And I believe that giving them the best care, if patients or if women at that point require surgery, can be a game changer in the way they can take care of themselves, improve their quality of life, and of course, who's the benefit at their better quality of life? The family, the society, the nation. So that is where I think the integration of technology in giving women a better health care will definitely go down the road. I myself witnessed right from doing open surgery when I graduated to learning how to do laparoscopy and then learn how to do robotic surgery for the last 13, 14 years. There's a sea change. And the bottom line, if you look at gynecological problems and surgery, I would say all this, if they can bring an open surgery to zero, we have done great for other women of our country. And that's what we aim for. Thank you.
Just while we are at this, how do you think, in your experience, we can better integrate women's health and wellness into the larger healthcare conversations that happen around the country?
Yes, I think this is a very good point that you brought about. Unless we have conversations about women, their health, their quality of life at every forum, and I'm glad that we are having so many men sitting in this forum as well, because whenever I go to talk, most often I'm called to a women's organization or on a women's day to the women employee. I wish men are there because they are part to our getting better or having a better quality of life. So integrating everything together in the society form would actually be a great way to improve what we are trying to do for women in our country.
Dr. Reddy, menopause and perimenopause are often under-discussed in public health. What steps can healthcare providers and policy makers take to normalize conversations and care around midlife women's health. Room also said.
Yeah. So I think the fundamental thing right now women's healthcare needs, whether it's menopause, whether it's pregnancy, whether it's any other gynecological problem, is education and awareness. And I agree with Ruma when she says that as things stand now, increasing awareness and increasing education just for women is not going to work. I think you should make their families partners in their wellness. And again here, technology can play a big role for education and awareness. Education and awareness, because these are all very structured things people go through. I think like the journey of pregnancy, the journey of menopause, these are all physiological changes, but they instill fear because it's an unknown journey that people are undertaking. And if we improve awareness of these conditions, not just for women, but also for society in general and their families, and make them partners in the well-being of women, it will make a lot of difference. And when we talk of using technology for education, I don't think it should be bland messaging. Now cell phone everybody has. People are on social media. Very often the messaging that you see is extremely bland. People are just going to swipe across. You should look at your target audience. Package your message well. Either in the form of short films, animes, something that holds a person's interest, will read it and will actually relate it to a real life event. For instance, you can narrate a story about a maternal death and tell them about what were the reasons, Mrs. X died. And that will stay better in their minds than bland messaging. And this has to be to the overall society, and there should be no hesitation in talking about these things. And, I think overall, and we also have a great celebrity culture in our society, which in a way is good because we can leverage them also to package these messages. I think fundamentally it's improving awareness, improving education that is going to sort out most of these physiological changes that occur in a woman's life journey, that is pregnancy and menopause. I think it's the fear of the unknown which kind of, can make things worse.
Thank you. Going from women's health to neonatal health, Dr. Satish, what do you envision for neonatal and pediatric care in the next 5 years in India? And do you see a significant rise in technology-driven solutions like AI for early detection and monitoring?
Yeah. Thank you. That's that's a question which is actually close to my heart. If you see technology and how it would impact both newborn and pediatric care, I could tell you my personal experience with the NGO that I run over the last 9 years. What I have noticed is, see, now both my children are doctors, but when I ask them what is the kind of preventive health care that happened in their school, so their kind of preventive care was, what's the kind of off-thal examination you had? Can you see this number? Can you see this? And can you see that? So the kind of preventive health care was very, very, very basic, and it's not accurate. But we all know prevention is better than cure. So what we have done in the last 9 years is, we thought the first and foremost thing is we had technology in place, number one. Number two, we had good infrastructure, and at the same time a good standard operating procedure as to how do we do the preventive health care. For example, if we have to do off-thal, everything from a refraction to a fundoscopy to a retinoscopy, everything has to be done in the periphery. So with that, what we have done close to 14,000 children across 5 Indian states. And the numbers are staggering. 22.5% of children have it. I myself, when I was 5.5, exactly, I couldn't see the board. I used to walk up to the board and then come back and write the notes. So obviously your performance comes down, right? Yes. So that is ophthalmology. So rather than just doing it for the sake of doing it, do it accurately. So that is for eyes.
Yes.
Next, if you see we have 7 stations. One of the station is anthropometry. That means your obesity, your stunting, and your growth or wasting. As she said, obesity is a problem, so is malnutrition, or so is stunting. You pick them up early, identify, you can do something about it. There's many ways you can do. Second. Third is, for example, again, childhood hypertension. How many doctors even know, other specialists know, that kids too develop hypertension? And in our percentage of children, I was discussing with you earlier, there were about 5.2% of children who have hypertension. And mind you, these are the children who, by the time they are 18 or 20, they have severe heart disease or kidney disease, or they end up dying. So it's either mortality or morbidity. So big numbers. At the same time, your audiometry. That means, am I using the best equipment? Am I using my OAE? Am I using my BERA? Am I using my tympanometry to diagnose them at that stage? So the percentage we picked up across these 5 states in the kind of either unilateral or bilateral deafness, or sensory neural hearing loss, or conductive hearing loss, is 3.2%. It's mind-boggling. So that is in terms of pediatric health. So let's go to mental health. That's something, again, we are working with IIIT, and we're trying to make huge strides there. We developed a system or a tool called Psych Screen, where I send a questionnaire to a mother, father, and an 11-year-old child, and based on that questionnaire, my tool can pick up whether the child is at risk or not.
Just one question. Is this tool being used only by you, or have you shared it with a lot of other hospitals across the country?
No. We are still, it's all validated, it's done, and we have got it used in about 14,500 children. It's working beautifully. I'm working to have more numbers. And we have integrated that to machine learning as well. And what we're trying to build is the next level. How do you integrate something else to build it better and faster? With the detailed psychological assessments, what is the percentage? Can I make, see, for example, Psych Screen is picking up 15% of children who are at risk. Now, the actual children who are really having a problem with detailed assessments is 4.2%. So now how do I reduce that 10% of the children who are picked up? So those we call the false positives. So this is what we are learning, and hopefully in the next couple of months, with the integrated tools that we want to do, I think wonders could be done.
That's amazing work you're doing. Yeah. We'll go back to Dr. Sivaranjani again. So from neonatal to adolescent health, especially among girls, is often neglected. So I'm saying adolescent health in young girls is often neglected. What steps can healthcare systems take to prioritize and address the specific needs of this group?
I think Dr. Satish has already addressed most of it. So I would say, whether it's a private school or government school, I think we need to have a counselor for the adolescents, or for that matter, any child to go and talk to. And it's very important to understand that it's not that we counsel the child alone. We counsel the family as a unit. Because most of the problems stem up from how the parents take care of the child, or, So it's very important. This is where I feel we are really totally lacking. Okay, we see that the child is eating well, okay, has taken bath, we have joined her in good school. That's it. And physical health, I think we have spoken enough about menstrual health, and adolescents need to know about sexual health, and also social media. How not to fall into the trap of, dangerous predators. This is one thing we have to make our adolescents aware of. If you see, Australia has brought a law, till 16 years they're not supposed to use social media. Yes. Maybe something like that should happen in India too.
Definitely. We're running out of time, so my last question to you, Dr. Jamuna.
Okay.
What role can preventive care, early detection and screening play in reducing maternal mortality and morbidity, particularly in low-resource settings?
Yeah, I think that's a good question. But adding to her adolescent health,
Yeah.
I think we have to talk about the abuse also at the same time. Nowadays, I think Foxy and all our members have taken a stride, and we have started one initiation called Dhira, and we are going to schools and colleges talking about those things and how to identify, and at the same time what are the protections taken. So just adding to that. And coming to our question, the prevention, I think prevention in the rural areas, it starts from the enhancing of the rural centers basically, and they have to be upgraded not only with the infrastructure, but at the same time, even with the human resources. And the women who are in remote areas, for them, the accessibility should be there. And we know that, for that accessibility, we need ambulances and the proper referral system. The person who is looking after these women should identify the complications or imminent anything, and that person should be able to refer the women for a tertiary care. And at the same time, and these technology like telemedicine, all these things do help. And now we have this AI-generated colposcopy, which is very good. And if we take into the remote areas, I think we can identify cervical cancers very early. And that way we can give the quality of services to these women.
Yes, thank you. Yes, of course.
Can I just add to the maternal mortality bit? So this, I think, there's a lot that we can be doing towards reducing maternal mortality, particularly in the remote areas. Access is one thing that she has mentioned. But we know during COVID times, we reduced the entire antenatal visits to just 4. 4 important visits, where, you started at maybe 8 to 12 weeks and stratified those who could develop hypertension or who had risk of developing some form of fetal anomalies. And so the chore of constantly visiting a health center just to get your iron and calcium tablets or 2 doses of tetanus toxoid itself exhausts women, and families. So I think moving on to a digital platform, that will be the greatest equalizer. Because if you reduce the number of visits, you'll enhance antenatal care. By the time you bring them for that ultimate event of delivery, the better state they are in, the less amount of disease, anemia and hypertension they have, it's far easier for them to navigate the process of delivery and come out of it well. So strengthening antenatal care and not making it a brick and mortar game. You don't need to have a physical facility, but you should enhance technology which can reach and become a great equalizer. And it can't be just based on financial incentives, because when you put into place financial incentives, you automatically create middlemen also.
But adding to that, I think now after this COVID, no women would like to go for video consultations. They say that no, we don't want a video consultation and we want to come physically for the antenatal checkups or whatever. And they feel confident and comfortable coming to a obstetrician for their examination. Probably we can reduce the number of visits, as you say, but then I think they are more comfortable and confident when they visit physically.
Another last thing we like to mention is the ORS crusade which Dr. Shivranjani is doing. Would you like to talk about that, please, before we end this discussion?
This is one thing which is giving sleepless nights to me and my family secondarily, because of the way I'm passionately trying to let everybody know that we have to hydrate people the right way, not just children. Everybody. This is summer, diarrhea, vomiting, dehydration. So the best liquid to give to correct dehydration is WHO recommended formula ORS. You'll have lot of Tetra packs in every pharmacy, online pharmacy, e-market, whatever. with the label ORS with a suffix or prefix, but they are high sugar drinks which will worsen diarrhea and dehydration. Even if they advertise and tell you that they are good for dengue or typhoid, please don't give to your loved ones or to anybody. Only WHO recommended formula ORS for correcting dehydration. Please.
Thank you. Thank you, all of you, for your valuable time and the things you've shared with us today. Thank you.
Thank you, Pooja. Thank you, Times Network.
Thank you, experts. That was truly enlightening. May I please request our honorable speakers to please remain with us just a little longer. We would like to take this moment to present a token of our appreciation, thanking you for your time and your presence here today and for sharing your wonderful thoughts with us. After this group photo opportunity, may I please request the moderator of this session, Ms. Pooja Sethi, to kindly present mementos to all our speakers on the stage. A big thank you to our eminent panelists. Can we please have a huge round of applause for them? That was truly an enlightening discussion that we just witnessed. Thank you very much, ladies and gentlemen. I request everyone to please remain seated because this brings us to our next and last session of the day on India's health tech revolution, rising from local to global, which talks about the healthcare technology, something that is touching all of us. The health technology segment in India, which comprises of over 10,000 startups, is projected to triple in value by the year 2028. The Indian health tech is expected to take a lead and create strong market acceptance. Local players are also expected to scale at an international level. Ladies and gentlemen, with these words, it's time to invite on stage those experts who are here to share their thoughts further and enlighten us on this incredible topic. May I please welcome on stage Nishan Ali, Founder and Chief Executive Officer, Neurologic.ai. Hari Talapalli, Chief Executive Officer, Call Health. Vikram Bhupala, Founder and Chief Executive Officer, Nephro Plus. Dr. Vidhi Bhanushali, Chief Executive Officer and Co-Founder, Scano. And may I please invite the moderator of this discussion, Dr. Karthik Anantaram, Vice President, International Group Oncology and International Apollo Hospitals. Today, our experts will share their thoughts on India's health tech revolution. Please begin by giving them a huge round of applause. Over to you, Doctor.
Hello. Okay, good evening. Thank you so much for that. I will still leave these 2 seats open for our panelists. I'm sure they're somewhere here and about to join us. But we have an excellent panel, and as we wait for Mr. Hari and Mr. Vikram to come in, I think this is a great session. What better way to maybe have the final panel on healthcare technology. So the topic that's been given is India's health tech revolution, rising from local to global. I think it's a fantastic way. We are here, and I think you must have heard about the recent developments that India has made in health tech. Very close to this place in Vizag, we have what is called the AMTZ, or the Andhra Pradesh MedTech Zone, which is India's only full-fledged self-sufficient medical technology device and manufacturing SEZ, or a special economic zone. So it's a great achievement that this neighboring state has actually offered to all of India. And we have an excellent panel today, and these are very, very accomplished people. It is my pleasure to introduce Dr. Vidhi Bhanushali. Dr. Vidhi is actually a dentist at heart, and she is a tech innovator by passion. And she's a leader shaping the future of oral health, and she's the CEO and co-founder of Scan-O, which is actually a dental diagnostics organization, tech organization, which makes smarter and more precise decision and diagnosis through AI. And she's bringing accessible solutions to patients not just in India, but also in markets like the United Arab Emirates, in several markets across Africa and Southeast Asia. So welcome, Doctor. I also have the pleasure to have Mr. Nishan Ali from Neurologic AI. So he has earlier worked with one of the largest healthcare companies, the United Health Group. And yes, now I welcome our co-panelists. Welcome, Mr. Hari, Mr. Vikram. Pleasure to have you here. You're just in time. Just once introducing the August panel we have here. So coming back to Mr. Nishan, he runs this company called Neurologic AI, which he founded together with his co-founder, Mr. John Gillot. And this company specializes in artificial intelligence-based solutions or algorithms that's trying to solve complex healthcare problems, which includes building foundational healthcare models for disease identification, possibly early disease identification, I suppose, using applications, commonly used applications like X-ray, computed tomography, mammo, magnetic resonance imaging, and pathological data. So welcome, Mr. Nishan. I also have the pleasure to have one of the very senior healthcare leaders from Hyderabad, Mr. Hari Thalapalli. He is the Chief Executive Officer of Smart Health, which is one of the leading, Call Health, one of the leading technology health tech companies based in Hyderabad, has been extremely successful in last mile healthcare service delivery in this part of the country. And also a pleasure to introduce Mr. Vikram Vipula. Welcome, Mr. Vikram, who is the founder, chairman, and managing director of a very popular company that's helping a lot of patients that have chronic kidney disease, so Nephro Plus, as we know. So it's a very august and a very distinguished panel that we have here. And staying true to the topic where it says India's health tech revolution rising from local to global, I'd like to start with a small anecdote, and I would like to pose using that anecdote to each one of our August panelists here as to how they have incorporated that in their business model. A little while ago, one of the leading technology companies in our country, GE Healthcare, came up with a concept called in-country for country. ICFC is what we used to call it as. Now, what was the thought behind it? The thought behind it was for many, many years, healthcare technology was imported into India. India was truly not considered to be a hub of innovation and building new products and services in health tech. So this was one of the organizations that took the first leap of actually bringing what is called as in-country for country. And that later on took a much larger form into becoming what is called as Make in India, but Make it for the World. Which means that there are so many other economies, countries, which are similar to our country culturally, in terms of GDP, in terms of what the patients can afford in healthcare, and technology is a huge, a bridge that bridges the gap in making sure that access is brought into many of these countries as well. So therefore, I will first start with Dr. Vidhi, that in her line of business, how has she adopted this concept of in country for country, and then later on expanding the horizon of that into made in India for the world?
Thank you, Dr. Karthik. I would like to thank the Times Group for arranging such a wonderful summit, getting all the stakeholders in one place to initiate these discussions and then eventually having outcome-based. Well, with respect to built in country for the world, I would like to present a small example. Let's go back a century. With respect to my discipline in dentistry, 100 years back, or even just 30 years back, India was importing literally everything. Whatever dental care that we are providing, right from the materials that we have to use every day to the high-end equipments, nothing was manufactured in India. Today, as you mentioned, we are manufacturing in the country and exporting out. There have been various programs which made that accessible, but with respect to one most important skill that we possess as a country, the technology skill, right? The talent with respect to technology. We've been leading the AI revolution, and by AI revolution I mean the ability to make healthcare accessible, more affordable, and reach it to the last mile in the country where all 140 crore people deserve it. If you look at the changing trend in dentistry, even today, more number of people have access to smartphone with internet, and less than half of them have toothbrush for their routine brushing. That means that affordability is not a problem. The problem was accessibility to oral awareness, accessibility to understanding the importance of what's going wrong into oral cavity and how is it affecting the overall health. And now through these technologies that we have built in India for the world, we are definitely seeing a change of trend where the awareness is increasing. Patient coming in for more proactive, preventive care is increasing rather than only corrective and cosmetic. And we be able to deploy our healthcare doctors, dentists for the world. When we see the situation in certain geographies like in the West, right, they're crumbling down. But we in India are standing strong, giving access to the entire world. Yeah.
Thank you. That's wonderful. If I were to pose the same question to you, Mr. Nishan, from a pure AI tech-led organization, how do you see this in-country for country model and then that kind of evolving into made in India and made for the world?
Yeah, thank you so much, Dr. Karthik, and really happy to be here. Thanks to the wonderful audience as well. In my views, the problems in India are very, very unique is because we have a huge population of 1.4 billion people spread very unevenly into different regions and geographies, having largest pool of villages, like there are I think 600,000 plus villages all across India. So the problems that we see as an Indians are also very, very different from the perspective of AI applications. I'd say just because the problems are very unique and the solutions has to be very unique as well. So from that perspective, providing care to all of those remote places, that is something, a problem very specific to our country along with some of the other countries as well. AI can really play a very big role in order to do early diagnosis, doing preventive cares. If I have to give you some examples, I was reading through some of the research papers recently. There have been some, let me take that example of brain stroke, which is one of the lethal causes of death in India. Like this probably the third most lethal cause of death right now, and sixth most cause of disability around Indians right now. there have been some certain remote operations done through a private company in Assam, where there were no hospitals, hospitals and like neurologists present. That's because India has a huge scarcity of neurologists too. Like, if I'm not wrong, this is one neurologist per million Indians. That's the bad ratio that we have right now. So imaging was done, and AI models have predicted the brain clots, and within a matter of a few minutes, results were out if somebody is suffering from brain stroke, which is very lethal. And what we know with the medical sciences progression, that the hour after the stroke is very crucial. That's called the golden hour as well. So if we are able to use some or other form of AI where doctors cannot really reach to diagnose patients with imaging and provide them preventive cares to recover, that's a very unique problem to solve. And that particular region in Assam was able to solve it with 97% accuracy in order to understand the blood clotting over there, which I believe is a very unique problem that we have solved in our country. And that can teach the entire world and become a true global solutions in a way.
Thank you. That's very insightful. Now I'll come to the story of Call Health. Mr. Hari is here. He's been leading this organization from the front for many years now. And this, as many of you may know, is a new age healthcare services company. And they built the world's first integrated platform that combines physical, virtual, and artificial intelligence enabled healthcare services in a very patient-centric manner. So my question to Mr. Hari is that I think before this panel, we heard a lot of good words of wisdom from our Honorable Governor, from our IMA President, etc. about Gaon Chalo, how do we improve access to rural healthcare, etc. And as we understand, the business model and the way how Call Health delivers its services is very apt in terms of enhancing access to healthcare even to the remotest parts of the country. So we'd like to hear from your experience, sir, about how Call Health is not just revolutionizing healthcare service delivery in the urban setting, but also into the remotest part of the country, which is where the true need is.
Thank you, Karthik. First of all, apologies to all of you. I know that this panel is in between your good times and the rest of the evening, but we'll finish soon. 2 points that come to my mind when we talk about capabilities that we bring in this country, which potentially is not only extrapolated throughout this country, but can be taken to the rest of the world. I believe there are great gadgets and devices that interesting and innovative companies like Vikram and others here in the panel, they are bringing to the world. But the question is, how do you take it to the last 100 million people? Not the first 100 million people who live in the 8 metros. That's not a big thing. But how do you take it to the others? And that's where companies like us come in. And we come in with a principle which I think is very important for us to look at, that the principle is whatever can be done virtually should be done virtually, right? And whatever requires a physical touch, we should find a way to deliver it at home. That's the capability that Call Health has built by bringing in not only virtual platforms that enable us to connect with people in the remotest corners, but also helping us to bring in people who can go home and do things which otherwise they had to go to a center and do. Now, this is a capability that we have repetitively done over the last few years. Now, on an average, we do 25,000 touch points with customers every month. Almost 40 to 50% of what we do comes in what people refer to as tier 3 and tier 4 towns, which means they're really inside. And we have people who are distributed, and we have mechanisms that let us know that somebody requires this service and somebody has started for the service, whether he or she has reached on time or not, and so on and so forth. Now, visualize that capability with fraud detection, with capabilities to prevent impersonation, and so on. So now, when you build capabilities like this, there are about 5 billion people across the globe who have similar challenges like what we have. And the way to look at this is to see whether these capabilities that we bring to the table can be taken and implanted into other countries and extrapolated into other countries. I think that's a huge opportunity, and that's something that we are looking to do. So 2 things that I would like to summarize before I hand over back to Karthik. When we think health tech, most of us think products. I think that's a flaw. Products is one important dimension, but services is another very, very important dimension. Because there are certain countries in the world where they allow us to do a doctor consultation or a data capturing sitting in India. So there are things that you can do, not only for this country, but you can do from here for other countries. And of course, there are capabilities that you can take to other countries and implant it out there. So I believe some of the capabilities, technology-led capabilities that we bring in healthcare, lend themselves to excellent options for countries and other locations outside India. And we can talk about it if there is time, but I see there is pressure on time.
Sure. No, thank you. Thank you so much. Coming to the story of NephroPlus, I think it's been a very, very inspiring one for many, many entrepreneurs. Thanks, Mr. Vikram, for putting this together. Maybe a few facts and figures that I could gather online is that NephroPlus, being a huge chain of dialysis centers, is set to reshape dialysis care in not just in India but in several other markets, where today they have served over 30,000 guests, or as you call guests, not patients. That's I think it's a great way of looking at how healthcare has moved into healthcare consumerism. So treat them as guests. And you have it across a network of 460 centers spread across 280 cities. I think a great example of penetration and access into the smallest parts of the country, and not just in India but in 4 countries. So I think this success story that you've had with NephroPlus fits very well into our topic of how NephroPlus has risen from local to global. We'd like to hear your best practices around it.
Sure. Thanks for inviting me to this panel. Glad to see on a Saturday evening people interested in listening to this panel. We run today, as of today, 475 clinics across 285 cities in 4 countries, serving about 32,000 guests across this network. We started 15 years back in Hyderabad with the first facility, and when we started, we didn't realize that it would scale up to this level, but just put our heads down, did a lot of private equity fundraising over the last 15 years, and about 5 years back, we realized that when you have to work with Indian price point of, let's say, 1,500 rupees or $20, we understood that we have built a lean and mean platform, which is not only relevant for India, but it could actually make a huge impact in other emerging economies. So 5 years back, we went into Nepal, and then we looked at Southeast Asia. We looked at Philippines as a very good market, 110 million people. Price point is much better than India. It's today 5x the price point of India. And of course, our economics are much better in Philippines compared to India. Now, what we leverage from India is the volume that we have built across the country. It gives us a huge procurement power. The tech that we have built, we are not a tech-driven platform, but tech-enabled platform. The lean and mean IT system that we have built over the last 15 years has served us well to very efficiently deliver care in other markets as well. Now, we took this platform, and when we impose the cost structure in other markets, of course adjusting for regulatory costs, the human resource cost and so on, we realized it's much more profitable to the network compared to in India. Now, India is the core engine, but we will, other than deriving volume and expertise and everything from India, we will make this impact in select markets. For example, 2 years back, we went into Uzbekistan in CIS region, and we are the largest dialysis provider, private provider in Uzbekistan. This year, we are planning to launch in Saudi Arabia. We took it as a challenge to compete with the world's largest networks. And again, I think competition is good. When you compete with the world's largest, world's best, your quality protocols, your expertise, your efficiency platform, the way you extract efficiency will also be challenged. So we love to compete with the world's largest and compete, and we beat them in Uzbekistan. Hopefully we'll beat them in Saudi Arabia. But I think India while it's very challenging market to deliver supranormal returns, it gives lot of expertise and the know-how to be successful in the rest of the world as well. And we are very proud to say that we are the only healthcare delivery company from India which derives more than 30% of revenue from international markets. So serving other markets is a big challenge because of various factors, but we love that challenging aspect and we continue to expand on the international front. Thank you.
Great. Thank you. Thank you. That's very, very inspiring, Mr. Vikram. I also had one follow-through question for you. Because I'm a part of a healthcare service delivery ecosystem. What we see is that patients who are on frequent dialysis are also candidates for kidney transplant. One of the significant challenges that we face, so I'm a part of the international ecosystem, I have a set of colleagues that drive the domestic ecosystem, is we find it very difficult to find donors. While we have patients, the ecosystem of having very dedicated structured registries of donors is not well defined across the world. Now, is that something that organizations like NephroPlus could take a lead potentially using tech integration, where we could also help these patients to eventually find a permanent solution?
No, absolutely. In India, organ donation is a very touchy topic, very sensitive topic, because the moment you regularize it, there's a lot of trade that happens in organ donation. So in India, there is very tight regulation on who can be donor, how do you prove that you're donating out of compassion and family relationship rather than economic considerations. I recently met the Union Health Secretary and I told him, in Nordic countries, when you take the driving license, by default, you are an organ donor. But you can fill a form, you can opt out of organ donation. So I told them that in India, if you keep opt out as a mechanism like Nordic countries, then legally you are authorized organ donors. When there is an accident case, when you are brain dead, then by default you are organ donor. That will increase organ donation significantly. But they said health is a state subject in India. It's not that straightforward. There is a lot of consideration. In India, unfortunately, there are many religious considerations where people feel that it's not good to donate organ. Organ donation is amazing. I'm an organ donor myself. It's there. It's just that the awareness around organ donation is significantly lacking. So we partnered with Mohan Foundation to increase awareness around transplants. We talk about transplants being the best quality of life option for dialysis patients. And we are working with the union government to figure out how, at least if few states start with opt-out mechanism, then other states will follow. But I believe that India, there are only 5,000 kidney transplants that happen for 1.5 billion people, which is abysmally low. But the government has to get the act together, because if it's not done carefully, then it becomes a trade. So it's not that private organization can quickly build a registry. It has to be driven by the government, enabled by the private sector, which we are trying to work on.
No, absolutely. I think the current regulations mandate related donors. There are countries like Turkey, South Korea that have taken a much larger leap with allowing non-related donors too. So maybe something to ponder about. But yeah, so I think that's great. Thank you. Now I move on to another critical topic. So we know about healthcare, tech, access. But at the end of the day, we also know that there is money required to access good quality healthcare. So there is a lot of disruption that has happened in the way how healthcare is funded today. So we just heard the previous panel speak about 1.8% of our GDP being spent on healthcare, and then there is a self-pay which further doubles it up to 3.6% of GDP, etc. But we've seen a lot of disruption in healthcare funding models, including what used to start as dedicated health insurance has moved into healthcare funding, which is now based on CIBIL score. And now there are artificial intelligence algorithms that are able to predict specific clinical outcomes in patients and then give differential insurance premium prices as well. So we have moved in that direction. So I'll start again with Dr. Vidhi, that in your business model, have you thought about disruptive healthcare funding models or healthcare financing models which enhances access to patients?
At Scano, I would say we are not just disrupting the funding model, we are disrupting the entire workflow, right from the screening to the way treatment is delivered. I'll tell you why I say that. When it comes to dental insurance, have you even heard of that concept in India? No, because dental insurance does not exist in India. Most of the patients who take actions at a very late stage, right? And I think a lot of people here in the audience would agree, dental treatments is equal to expensive treatment. And why? Because action is taken at the very end stage, where we do not have the capabilities of saving that tooth. The only option remaining is to do a root canal treatment, or just extract that tooth, put an implant, or maybe do a full mouth rehab. The attrition of teeth is at such a level that we need a full mouth rehab, right? So the whole flipping the question from bearing that high expensive treatment to getting it diagnosed, to getting it screened at the very initial stage, which would not just save money, but eventually a lot of pain that a patient goes through and a lot of time which is spent on that scary dental chair, right? So, and you'll all be very shocked to hear that 90% of oral diseases are preventable. But once it starts, it's irreversible. So it doesn't reverse back. So let's take an example of cavity, right? At early the panel, we got that 18% of India's population is suffering from diabetes and hypertension. Any guesses what percentage of our population is suffering from dental cavities and gum problems? 75%. So out of 1.4 billion people, 1.1 billion are already suffering from issues, and you will be even further be shocked to hear that less than 9% of them are coming for treatments at the very end stage. So now imagine if this capability of screening is given to everybody's mobile, right? It's made scalable, where a person can just screen his mouth and within a couple of minutes understand what's his oral health score. We know our HB, we know our RBCs, we know our skin score, hair score, but what about oral health score, right? So you would know your oral health score, you know what oral type you have to use the right products, and you would have a specific set of habits that you need to inculcate in order to prevent that kind of pain, expense, and time that you're going to put in. But since the prevalence rate is already high, 75%, talking about how can we work on that funding, it's not just about having accessibility of funds for a dentist to set up so that he can deliver care, not just in primary, secondary, but in tertiary markets, but getting that access of loans to our patients, right? Even today, in India, we have very limited number of players who are giving that kind of funding options to the patients. They do not have it. Insurance, as I suggest, doesn't exist. But an additional point through this AI screening is, have you ever wondered why do not we have dental insurance in India? The answer is very simple, lack of data. We do not have data to assess risk. How would we underwrite the risk of that particular individual? Let alone having personalized premiums for individuals, apart from that set targeted groups that we do see in health insurances. So how AI is changing the game is now we do have not just one scan, but periodic scan of a single individual with various phases of his life, with various histories, which would help insurance companies to underwrite and assess the risk of that individual for premium, for personalized premiums. And it's already happening as we speak. In the developed countries, in first world countries, we are already helping insurers to assess this, while in India, we are enabling our partners to have that data, and not just the scans, but which are integrated with the insights. Now imagine out of 32 teeth, right, 4 are already grossly decayed and nothing could be done. But how can we save on to those 28 teeth? Because teeth are not just an individual part of your health, right? You will be shocked to know majority of the health symptoms and signs are seen in the oral cavity. Are you on a verge of becoming diabetic? Your mouth says that. Could you have a silent heart attack, by the way, which is a changing trend in the early 30s and 40s? Your mouth can signal that. During pregnancy, are you prone to preterm delivery, early delivery? Yes, your mouth can say that. But are we really integrating these data points along with other specialities in giving them holistic outcome to patients? I'm not sure. But time has come that we start doing that. And once we do that, obviously the part of insurance, personalized premium will be solved because we have the data, but we'll be seeing much better patient outcomes and a reduced burden with respect to oral health diseases, not just India, but globally.
I think that's wonderfully said. In very simple words, oral health is like a mirror to gut health and possibly overall health. So that's how it is. So that's great. Now I'll move a little into the rapid fire mode. So I'll move to Mr. Hari. We've seen that your organization has evolved from a B2C into a B2B2C organization. Healthcare, and this is a very pertinent topic. Some years back, any decision that a doctor made was considered to be godly. I think now with access to data, information and the internet, people are more aware and they have access to information. They come well informed. So healthcare has moved into healthcare consumerism. It's not just doctor driven anymore. It is people driven. It is consumer driven. Patients are more aware, have access to data, and so do their relatives. So with this changing trend with access to data, how do you see business models of Call Health, and I'll come to then Nephroplus, where you have educated people with access to right information coming, seeking good quality healthcare. So what does that, what kind of impact would that have on your business model and your approach to market?
See, when we started as an organization, we started as a B2C company, and what we realized was that maybe the last 40, 50 years of structural processes had oriented us to be more of a curative, episodic kind of a country. If you know what I mean, we went only when there is a problem, like what my friend here was saying, Vidhi was saying. And the second was that you went for a problem, you got it sorted, and then you forget about the whole thing, right? So the continuity of care, or the preventive and personalized care, was something that we realized was not in our DNA. And to that extent, what we realized was that most of the services appeared to be more tuned to seeking it when I need it. We realized that that's not a business model that could help us establish and scale the way we would want to. So we decided to go to people who could help change this culture. So we found two predominant players. One is the payer universe, the whole insurance segment, and the second is the corporates. And we said that if we can work with you to move culturally into more of preventive and continuous care, that could help the beneficiaries or the people on the ground as well as organizations like us. Because you are able to bring in data points across a period of time and do a longitudinal analysis of what is going right or what is going wrong, which is something that technology helps you do today. And like what Vidhi was saying, you are able to predict what can be your problem if you don't address this right now. So that's what technology is helping us do, and that's what we are focusing towards. We have found that to talk to payers is not going to get you the results. You also have to talk to the reinsurers on top, really. Because you have to come from there down to the insurers, down to the beneficiaries. So a lot of what we do now is B2B to C, and is focused more towards preventive, personalized, continuous care, and empowering the patient to understand where he or she is today in the health spectrum, and whether they can do a few things to improve their what we call as the health index. So that's where we are pushing with technology, and hopefully, companies across the world are multi-billion dollar valuations today who are in this space. And that's probably where we can aspire to go to and take the solution to the rest of the world. So that's how I would.
If I were to pose the same question from a Nephro Plus perspective on healthcare becoming more consumer driven and oriented, so what's been the impact of that on your business model?
No, I love the fact that it's more consumerism in the play right now. The more the awareness increases, the more consumerism is at play, the better the clinical outcomes will be. Because the market will react to the pressures of the customers at the end of the day. If it's purely driven by the middle B, then the end customer will only receive care. They will not be able to shape the care. We believe that right from day one, we looked at it as while we partnered with hospitals, we partnered with governments to deliver care, our overall focus was on the final C, the consumer, the customer. And that's how the guest word was started right from day one. We use the middle B or middle stakeholder as a way to serve the final C. And right from day one, we have been focused on how to delight the customers, how to increase awareness among the customers about the various options. What does dialysis quality mean? What are the various options to improve, upgrade their clinical protocols? I believe consumerism is going to be much more focused on, much stronger force going forward. And we love the fact that more aware consumers, the more they are aware, the more they will demand from the providers. And the more they are aware, they will choose the right provider who is offering better quality, better service level. The problem we saw in India is that most of the times consumers are just receiving care in a very passive manner. And when people are not enabled, when people are not powerful enough to understand what is going on, what are the clinical issues, what are the service level issues, then they just become very passive and they die very quickly. The more consumer is aware, the more they are knowledgeable, they will demand the right care from the providers. And that's what differentiates NephroPlus from the other providers. So we love consumerism. We are looking forward to even more consumerism in the future. And the more demanding the guests are, the more we are on our toes. It's actually very good force for us to deliver even more value, even more clinical outcomes, even more service levels if our consumers push us very hard. Yeah.
More power to you. Thank you. That's wonderful. Now I have a very interesting question for Mr. Nishan, whose company is completely around AI. Recently, I think most of you might have heard the news that China launched the first AI-driven hospital. Right? So the question is, would humans go to a hospital where clinical decision and prescription is handed out by AI? I don't know the answer to the question. I will ask that question to Mr. Nishan, that would AI one day run hospitals? I also have another question. I learned something new today, thanks to all of you. I had learned until generative AI. Now I understand there is something called agentic AI that has come, which has evolved from generative AI. So we would like to understand from you, what is the future of healthcare services delivery in this era of AI? And how do you see this would be like an emerging trend?
Yeah, sure, Dr. Karthik. Just to begin with, I'll start with what an agentic AI system is. It's about, powering LLMs to run systems autonomously without either completely autonomously, or in semi-autonomously, where there would be a human in loop, but that human would be empowered by an autonomous system to make their decisions faster. Coming to the next step of your question for that Chinese hospital, with the things that I have read so far, that's a wonderful approach that they have taken of creating a virtual hospital, having 10 agentic AI powered doctors and 4 agentic AI powered nurses. And guess what? Just in less than a month of time, they were able to treat 10,000 people virtually. which otherwise would have taken 2 years in normal course of healthcare system. So definitely this seems to be the future of healthcare. But again, coming to the reality is because AI in healthcare is something which is growing really fast, but there has to be a lot of regulations around the data privacy and the reliability. We as Indians have been, we have learned and we have lived in an era where we actually treat doctors as gods who saves our lives for obvious reasons. And we have developed that trust in us, and it would be really, really hard at the moment to change that entire faith and trusting an autonomous system to do your treatment and take medicines from that system. Even though it could be correct, it may not be as well, is because even wherever there are AI and autonomous systems right now, there is a slight bit of risk, of course. No matter how accurate we are, there would be misaccuracies, and for that particular situation, we need doctors in place, staying in loop with the AI systems, so that even though AI could just help doctors as an assistant over here to make them empowered, to give them additional informations or even the entire analysis, but there has to be, the decision has to be made by a qualified doctor, because it's after all matter of life and death of a human. And this is something I believe I'm not seeing in very recent near future this particular concept could be changed as such.
Again, I think as Mr. Subramaniam rightly pointed out in one of the previous panel, no technology will replace a human doctor. I think human doctor will continue. There is nothing that is, I think, more superior to a human brain. AI was also built by a human brain. And most importantly, clinical decision making and medical legal aspects need to be adhered to and conformed to. So therefore, that will continue to remain too. But thank you. Now, before we come to the final aspect of the final discussion, I just have 2 rounds of rapid fire questions. You might just answer it in one single sentence, each one of you. For each of your respective businesses, many people think that investing in artificial intelligence is an investment. It's a cost. But there are people that believe that investing in AI is a revenue generator, and incrementally so. So please let us know, maybe in a statement, quick statement, how has AI proven to be not a cost but a revenue generator for you? We'll start with Nishan and then we go on the panel.
Yeah, sure. I mean, you see, my company is all about AI, so all the revenue comes from AI for me.
We won't ask you what your revenue is.
Yeah. But again, I mean, to do the value realization, AI is meant for efficiency. It's meant for having that particular gain of efficiency. If I talk about even disease identifications, and in the world of radiology, right, the entire world has a scarcity of radiologists. Even in India, we have around, I think, 20,000 radiologists active, be working with us, which leaves us to around 100,000 people per radiologist. With that particular advent, probably a radiologist would need to do 150 plus scans every day, which is almost impossible, right? Even in US as well, there is a scarcity, because we have been working in US market for quite a bit of time, over a couple of years, and the problem is all over the world, basically. What I see AI doing is to empower the people and making decision makings faster by providing extra bit of additional informations to the decision makers, increasing the efficiency, which means at the same time you can do more work. Definitely this is a multifold outcome which would be coming through it. Even if we just talk about the rest of the world as such, is because coming out of the healthcare and the larger group of the world. So there have been companies who are investing in AI and in agentic AI specifically to gaining efficiencies. I was just reading in a blog yesterday that Satya Nadella of Microsoft is the CEO of the Microsoft, who said recently Microsoft had written 30% of their code using agentic AI. Can you believe this? The entire company's code, which was developed in recent past, in a year or so, 30% of them was written by agentic AI. That's a huge number and huge efficiency gain. So definitely there are multifold return of investment which are supposed to be coming from AI. Yeah.
Great. So turning it over to Dr. Vidhi. So your quick rapid fire take on it.
I would keep it simple, backed by an example of already existing workforce that we are serving. More than 500 plus Cano Air clinics using the technology who have served 1.2 million plus patients. And how do we justify AI not as a cost but AI as a revenue generator? 65% of our users have seen better health outcomes, spending less money because they are going for preventive care, regular scans. Because it's hectic and it's boring, plus it's also fearful to just go every 6 months for a checkup versus just doing a quick scan on your mobile phone and understanding the entire score, right? With respect to our partners, the Bs who are engaging our Cs, who are delivering these services, on an average, our partners have seen the revenue growth anywhere between 45 to 60%, depending on how and where are they leveraging. So what AI is doing is instead of doctors sitting in the clinic waiting for patients to come, we are able to go where patients are. So with our AI robots, right, the robots are now deployed in malls, schools, colleges, corporates, housing societies and so on. So imagine the kind of impact and revenue growth for both the doctors and better health outcomes for our patients.
Thank you. So our MC is back on stage. That means that we really need to do rapid fire. But again, Mr. Hari, if you were to put it in one statement.
Yeah, no, I'll put it in simple terms. We work with about 1,500, 1,600 different providers across the country and deal with, like I said, 25,000 instances of interaction. The ability to identify fraud, the ability to identify mirror reports and so on is something that is humanly not possible. So AI helps us identify those and therefore better and sharper clinical accuracy in what we do. That's the first part. The second one is to now we are in the process of building something which will help us connect different points of health. Your medical history, your family history, your lifestyle, through devices that you wear. So we are trying to connect those so that we are able to provide a meaningful input to the customer, but that is still in a testing phase. It is still not launched. So those I would say is more around experience, not around revenue.
Mr. Vikram?
So right now we have leveraged AI only on the cost side. For example, our customer service is completely run by chatbots, AI chatbots. But I predict in the future a lot of sales engine being driven by AI, but hasn't happened yet. Only on the cost structure we have seen efficiency so far.
Thank you. I wouldn't ask the last question, but I'll talk on behalf of the panel. And MC, I'm mindful that you're here. So it was about the last part. The United Health Group, you were a part of UHG. So they've launched a new health tech startup fund. So naturally, they are looking for organizations. So what I've learned from some of our mentors as well is that I think all the successful entrepreneurs you see on stage here had their journey begin with a purpose. I think as long as the purpose of the startup is well defined, there's nothing stopping it. That's how I'd like to sum it up. But once again, thank you. You've been an excellent panel. If I were to sum it up, so in country, for country is here to stay, and in India, made in India, made for the world is here to stay. Healthcare consumerism is good for business. So that's there as well. Disruptive funding models is very important too. Data integration is important. AI is good, but not to replace the human mind. So human mind, human intelligence will continue to exist. So God bless. Thank you so much. You've been an excellent panel.
Brilliant. Thank you, ladies and gentlemen, for a very insightful discussion. I request our speakers to please remain with us on stage a little longer. May I please invite Ms. Pooja Sethi to kindly join us on stage to take this moment to present a token of our appreciation, thanking our speakers for their incredible time, their presence, and for sharing such amazing things that probably we've heard lesser. It is, I can say nothing replaces words when they come from experts in the industry themselves. And those were truly pearls of valuable wisdom that we have heard. And it has been such a pleasure to have our speakers join us today and to share their thoughts with us on this platform. What a wonderful day it has been. Can we please have a huge round of applause for them? Thank you, Ms. Sethi. And for the final time, let's have a huge round of applause for our speakers. That was a brilliant discussion that we just witnessed. Thank you, ladies and gentlemen. It is a matter of great pride that the south of India leads the pack when it comes to major innovations being driven from the heartland of our country. You know, right from being the pharmacy of the world to becoming an innovation hub, healthcare legends here in South India have put together their energies to eliminate health inequities and have attained a very unique position of having witnessed a massive growth in medical infrastructure, making quality healthcare accessible to patients both in private and public healthcare sectors. The surge in investment that we are seeing year on year is truly poised to transform southern India's healthcare landscape, building a robust medical infrastructure. And all of you, ladies and gentlemen, are a part of this incredible industry that is truly changing lives day by day. But that is what we witnessed here today, and that is what this evening has been all about. To bring together health and pharma honchos of South India who brainstormed, shared their insights, swapped ideas and deliberated on the new imperatives of the Indian healthcare and life sciences here at the Times Network India Health Summit 2025 South Edition. We would like to also take this moment to thank those who made this evening happen. This event is driven by Audi Hyderabad and our robotics partner, Prospero Dynamics. What an incredible evening indeed it has been, ladies and gentlemen. But this brings us to the final set of awards for this evening. There is so much to thank everyone for, and finally today we would like to take this moment to honor excellence and recognize brilliance in healthcare here in South India. To present our final set of awards this evening, may I please call upon our guest of honor, Dr. Dilip P. Bhanushali, to please join us on stage. Ladies and gentlemen, let's have a huge round of applause for him, please. To receive the award for excellence in interventional pulmonology and sleep disorder, please join me in welcoming Dr. C. Vijay Kumar from Apollo Hospitals. I request all our award winners to please remain with us until the end of the event. We would like to take a group photograph towards the end, so I request all our awardees to please remain with us and please don't go anywhere until the end. The next award is to the Center for Excellence in Advanced Dental Care. Ladies and gentlemen, this award goes to Park Dental Care. Here is the entire team taking care of your beautiful smiles day in and day out. Congratulations, Park Dental Care. Next, we would like to felicitate a visionary in neonatal and pediatric critical care. May I please invite on stage Dr. Satish Ghanta, founder Little Stars and She Hospital and Choice Foundation, to please receive this award. With the next award, we felicitate a visionary in first aid and preventive pediatrics. Ladies and gentlemen, please join me in welcoming Dr. Sivaranjani Santosh, Chief Pediatrician of Magna Centers, to receive this award. The next award recognizes the best emerging robotic joint replacement surgeon. May I please welcome Dr. Vikram Bairi, consultant orthopedician of Yashoda Hospitals, to please receive this award. The Emerging Life Sciences Company of the Year award goes to Calren Care Life Sciences Private Limited. May I please welcome the director, Mr. Chandrakant, to join us on stage. The next award recognizes excellence in hand, wrist and microsurgery. Can I please invite on stage Dr. Gopinath Bhandari, Senior Consultant, Apollo Hospitals, to receive this award. Next, we would like to recognize an icon in IVF and assisted reproductive technology. Please welcome Dr. Aarti Deenadayal T, Clinical Director, Mamata Fertility Hospital. The Excellence in Quality Healthcare Delivery and Precision Medicine Award goes to Continental Hospitals. Can I please request the Director, Mr. Raghunath Reddy, to please join us on stage to receive this award. The next award is for Excellence in Generative AI in Radiology and Disease Prediction. The award goes to Neurologic AI. I request the founder and CEO, Mr. Nishan Ali, to please join us on stage to receive this award. The Excellence in Arthroscopy and Sports Medicine Award goes to Dr. Arun Montella, Senior Consultant, KIMS Hospitals. The next award goes to a visionary in urology. Ladies and gentlemen, please welcome Dr. Purna Chandra Reddy, Executive Director, AINU. The next award recognizes excellence in implantation audiology. Please welcome Dr. Indlamuri Shrikant, Senior Consultant, Apollo Hospitals, on stage. The next award is for excellence in physiotherapy care. This award goes to Dr. Shrikant Pisala from Argala Revive. The next award for excellence in robotic innovation for business transformations goes to Prospero Dynamics. May I please request on stage the founder Ritesh Dev to receive this award. We thank you for your incredible support in making this evening happen as well. Thank you, Mr. Ritesh, and to the entire team of Prospero Dynamics. The next award this evening recognizes the Best Emerging Fertility Center. Please put your hands together for Fertilica IVF. Dr. Samina Reddy, founder and chief fertility specialist. The next award felicitates an icon in nephrology. Ladies and gentlemen, please welcome Dr. Ashwini Kumar Panigrahi from Apollo Hospitals. Next, we would like to felicitate the best emerging team in collaborative ENT care. This award goes to Team ENT, Dr. Ramya, Dr. Ravi, Dr. Sandhya, Dr. Madhav and Dr. Tejaswi of Apollo Hospitals. Our final award this evening, recognizing brilliance in healthcare, goes to Excellence in Oral and Maxillofacial Surgery. The winner is Dr. Sukhwinder Bindra. Hearty congratulations to all our award winners. May I please request our guest of honor, Dr. Dilip Bhanushali, to be with us just a little longer, sir. We would like to take this moment to say a big thank you to you for being here with us today. May I please request Ms. Pooja Sethi to kindly join us on stage to present a token of our appreciation to you, sir, for taking out time from your extremely busy schedule, for being here with us, for sharing your wisdom with us today, and truly leaving us inspired and in awe of what the future of healthcare in our country and especially in South India looks like. Ladies and gentlemen, can we please have a huge round of applause for him? Thank you, sir. Thank you, Ms. Sethi. Thank you, ladies and gentlemen. All that begins well must end well, but firstly, I would like to take this moment to congratulate all our winners who joined us on this stage this evening. You are all incredible. Ladies and gentlemen, you are changing lives day in and day out. And this evening was just to say a big thank you to you, to take you through what is happening in the healthcare industry, and we're truly proud of all your achievements. It's been an energetic and an insightful evening, and it has been absolutely incredible. Once again, we would like to thank Audi Hyderabad and Prospero Dynamics for supporting our vision, and more importantly, the team who brought this vision to life, the entire organizing team, our team at the console for the incredible work, the team who worked backstage in bringing this event to life, our incredible team behind the cameras. You have all been amazing and you made this evening happen. I hope we go on to inspire you just the way you inspire us day in and day out, ladies and gentlemen. I thank you all for joining us from your busy schedules, being here with us. And now we are open for cocktails and dinner. Please continue to network with us. I would like to thank the Times Network for giving me the opportunity to be here. What an incredible day it has been at the Times Network presents the India Health Summit 2025. Once again, a big thank you, Audi Hyderabad and Prospero Dynamics. Ladies and gentlemen, please, I would request all of you, all our awardees today, to please come together for a group photo opportunity. For the final time today, we'd like to freeze that moment on camera. All of you in one frame. I request all our awardees to please join me on stage for a final group photo opportunity. Quickly, I request all of you to please come on stage. Ladies and gentlemen, also let me remind you, please do not forget to share your media bites with us outside at the registration counter. We thank you once again for your incredible support. My name is Michelle Shetty. It has been an honor being your host this evening. Take care, keep inspiring. Good night and God bless.